Are you ready to be vaccinated? Yes? No? Well, you're going to have to for various reasons, especially if you plan on traveling to some countries anytime soon. Yes, the vaccines are here, and so far all the states in Nigeria have some consignments sent to them, except Kogi State. We'll tell you why in our Abuja wrap. We told you in our first episode for 2021, this is the year of the vaccine. Logistics for a nationwide rollout, tackling vaccine hesitancy, side effects of the vaccine, all this is in the front burner of national discourse. And we get more insight into the rollout plans for the FCT in our feature story. Our interview today is with the Executive Secretary of the FCT Primary Healthcare Board on feedback mechanisms from those who have received the vaccine, cold chain facilities in rural areas, and the FCT administration's distribution plan. This is Dateline Abuja. Hello and welcome to Dateline Abuja. I am Kayla Megwa. After all the drama surrounding the Oxford-AstraZeneca vaccine, the European Medicines Agency has declared it safe for use. For those of you who still have doubts about this vaccine, Oxford-AstraZeneca's vaccine is seen as the most important globally because it is easy to manufacture and distribute at fridge temperature, and the cost of production is very low. Vaccine hesitancy is not a new thing. Many people are naturally resistant to change. But this is important for the sake of those who are not as healthy as we are. The rollout has started across the country, except in Kogi State. We'll get to that shortly in our Abuja wrap. Also on our wrap, the Director General of the World Trade Organization, our very own Dr. Ngozi Okonjo-Iweala, visits Nigeria. Take a look. President Muhammadu Buhari is asking the Ministers of Justice and Women Affairs to engage with the National Assembly to ensure implementation of 35% affirmative action as constitutional and electoral reform processes are ongoing. President Buhari declared this during a courtesy visit by the National Working Group of the Supporting Advancement for Gender Equity Initiative at the State House.
Since directed the Attorney General and Minister of Justice, in collaboration with the Minister of Women's Affairs, to immediately inaugurate an interministerial gender-based violence management committee to address all forms of violence against women and children in the country. This body is already in place and running. In addition, I have approved that 45% of the small and medium-scale enterprise funds be reserved exclusively for women.
Meanwhile, the President is demanding a periodic performance report from the Minister of Health for the Global Fund's $890 million support to Nigeria to combat HIV and AIDS, tuberculosis and malaria. Speaking at a launch in the State House in Abuja, President Buhari also asked the Minister, Dr. Osage Ehanire, to set up an accountability mechanism to ensure the fund is not abused.
Let me also emphasize here that this administration has zero tolerance for corruption and inefficient use of resources. In this regard, I hereby direct the Minister of Health to set up an accountability framework to monitor the use of this fund and provide periodic performance reports to my office.
In the meantime, Vice President Professor Yemi Osinbajo is restating the Buhari administration's commitment to ensuring Nigeria becomes a technology haven, producing homegrown scientific solutions to 21st century problems. He made the commitment while declaring open the Technology and Innovation Expo 2021.
We have some of the brightest and best minds in the world in the innovation economy, and I'm convinced that this cohort can and should be the vanguard of our efforts, not only to foster economic recovery, but to reposition Nigeria entirely as an innovator's haven. I'm aware of the efforts of the Federal Ministry of Science and Technology in its contribution to the provision of homegrown solutions, especially those to prevent and/or minimize the effects of the pandemic on the healthcare system of the nation.
The Director General of the World Trade Organization, Dr. Ngozi Okonjo-Iweala, was in Nigeria for 4 days, her first international visit since assumption of office. During her visit, she met with the governor of the Central Bank of Nigeria, some federal ministers, the secretary to the government of the Federation, Mr. Boss Mustafa, the vice president, Professor Yemi Osinbajo, and President Muhammadu Buhari. During her visit, she dispelled fears that embracing the free trade policy of the World Trade Organization would harm Nigeria's economic diversification plan.
Free trade has lifted hundreds of millions of people out of poverty, but it has also left some people behind. So there is no doubt that there's inequality. Not everybody has been lifted off. There are poor people within rich countries, and there are poor countries in parallel with rich ones who have not benefited from trade. This is why we are very keen at the WTO to support women entrepreneurs. We have something at the International Trade Center called She Trades, which aims to support women to improve their trade and get into the value chain, regional, national, global, and regional value chains.
The President General of the Nigerian Supreme Council of Islamic Affairs and Sultan of Sokoto, His Eminence Alhaji Mohammed Saad Abubakar, says though the council has endorsed the vaccines, it will not force anyone to take it. He said this at an event to sensitize Muslim scholars and imams organized by the National Primary Healthcare Development Agency.
Like I said in my last opening remarks, it's left for you to want to take the vaccine, because we will not force you, in the sense that when you are hiding in your house, it will not even come to your house, we won't see you. We only advise you, we only try to appeal to you, like we did with the polio vaccine decades ago, and today we are polio free.
Welcome back. The nation's capital officially began its vaccine rollout 10 days after the national rollout. 227,000 doses, 65 vaccination centers and teams, and a focus on frontline workers, strategic leaders, and military personnel. Our feature story looks at the work done so far in the FCT vaccine rollout and plans to tackle challenges like vaccine hesitancy and proper vaccination in rural areas. 10 days after the national rollout of the COVID-19 vaccination in Nigeria, the Federal Capital Territory Administration is commencing the exercise in the nation's capital. This is the first phase of the exercise in the nation's capital and its largest single vaccination program, which is expected to herald the control of the virus in the nation's capital. The FCT is getting over 227,000 doses of the vaccine and has set up 65 vaccination centers and teams for the exercise.
Today marks an added impetus to our response efforts with the flag off of COVID-19 vaccination. In line with this, the vaccination pillar has been established in the EOC to drive the vaccination activities in the FCT and ensure successful completion of the exercise. Our target is to achieve herd immunity and significantly control COVID-19 pandemic amongst the FCT populace through vaccination of at least 70% of our population. We will therefore work diligently to ensure the security of the vaccines and prevent leakages, but adhering strictly to national protocols in administering the 227,480 doses allocated to FCT in order of recommended priority. To this end, I call on all FCT stakeholders not to relent in their continued efforts at responding to the pandemic and in observing all the existing non-pharmaceutical protocols in order for the optimal benefits of the COVID-19 vaccination to be realized in the FCT.
Over a 10-day period, frontline health and non-health workers in all private and public COVID-19 isolation centers, treatment and laboratory centers will be vaccinated alongside other health workers, strategic leaders, military and paramilitary personnel.
Prioritizing healthcare workers for this flag off today is quite critical, because this will help to build the confidence of these frontliners who are the front line of the response, protecting our lives and saving lives every day. It will also help to motivate them, and it will encourage other people who are still sitting on the fence with respect to the COVID-19 vaccine. For strategic leaders to be involved in this flag off too, we hope that it will reduce vaccine hesitancy and improve the acceptance of this vaccine. And finally, we cannot also afford to drop the ball on the non-pharmaceutical intervention that has been proven to work before this vaccine. So in as much as we flag up vaccination, we should also continue to adhere strictly to the non-pharmaceutical intervention, which includes continuously washing our hands, wearing our face masks regularly, and also avoiding mass gathering and maintaining physical distancing.
The vaccine is safe, it is effective. Please ensure that those that are supposed to collect these vaccines get these vaccines. All health workers should ensure that they register, have themselves vaccinated, to show that they can also continue in this fight against COVID. And for our strategic leaders, please call on your people to come out whenever the time for them to be vaccinated, and receive this vaccine. But meanwhile, we must continue all the non-pharmaceutical precautions. Let's continue wearing our masks properly, hand washing, also maintaining distances, avoid crowds, and ensure once you are ill, you report immediately to a health center. So from the page, I bring you good messages, and I'm letting you know that we are here, we are committed, and we'll go to the last mile to ensure that those that need to be vaccinated are vaccinated. And we'll follow up to ensure that we do not have, we address any issues that come along with the vaccination.
Traditional and religious leaders as well as area council chairmen also received the jab at the ceremony. The idea is for them to take the message to the people on the street.
Myself and FCT Council of Chiefs, we promise to carry this message to the grassroots. We are going to deliver to our people what we are doing here. But please, I wish to appeal to the Honorable Minister of State that my appeal is we should make sure that they have adequate vaccine that will go around the FCT. It will go well after we have taken the vaccine to the grassroots and the vaccine is not available. If you can do us that favor, we'll be the happiest.
The most critical stage of this vaccination is the local areas where we are coming from. Collectively, it's like we have been anxious for a day like this to come, because most affected place that the economy completely was grounded is in the area council. As such, we promise to pass this message and give adequate information for everybody to participate.
The FCT administration explains that storage facilities have been set up in all the area councils to ensure a hitch-free exercise, insisting that the vaccines are safe.
It is true. It has not been a common in the history of vaccinations for a speedy solution to be found, and this has caused skeptics to even doubt its genuineness. But I can see it as a solution that is deserved in order to help us to find an end, to bring to an end the COVID situation. The figure is also going down, but that does not mean it has ended. But when you are vaccinated, it confers a lot of immunity on you.
Previously, the FCT led the way in several vaccination campaigns against disease, such as polio, measles, meningitis. And I want to assure you all that this will not also be different. We are committed to ensuring that the FCT serves as an example to other states in surpassing all COVID-19 vaccination targets. And I know this largely will be also because of the support we enjoyed from all royal fathers, traditional rulers, community leaders, our chairman of the area council, religious leaders, both of the Khan and also the League of Imam in the FCT. And surpassing the COVID-19 vaccination targets, 310. Ladies and gentlemen, the FCT will resolutely enforce all national guidelines and ensure that all stages of the vaccination rollout are equitably and fairly implemented, and all the 227,480 doses received are accounted for.
The administration continues to insist that it will encourage and ensure strict compliance to the COVID-19 protocols
despite the rollout exercise.
My guest on the program is Dr. Iwat Akpan, the Executive Secretary, FCT Primary Healthcare Board. Now, it's important to note that this Oxford AstraZeneca vaccine requires 2 jabs, with a 3-month interval between jabs. So everyone who's been vaccinated right now will have to take a second dose in 12 weeks. Are there side effects to the vaccine? Do cold chain facilities work in rural areas? What are the adverse effects of vaccine hesitancy? When do we expect the whole of the FCT to achieve herd immunity? He walks us through all these and more during our interview. Dr. Iwat, welcome to Dateline Abuja.
Thank you, Kela.
So you've been vaccinated, congratulations.
Exactly, absolutely.
It's the first shot.
First shot.
For everyone who's been vaccinated right now, they're going to have their second shot in about 3 months or so?
12 weeks, 3 months.
3 months, 12 weeks.
Exactly, and the scheduling is automatic.
How does that work?
There's a list of vaccines. So the one that you have been administered, immediately you put that one, it will show you automatically the date we are going to have a second shot.
So how many vaccinations have we had in the FCT, including the president and the vice president?
God.
How many so far?
Thank you so much. On the 5th of March was the national launch, and we had the FCT launch on the 15th. After the national launch, we had the president and the vice president on Saturday. That was on the 6th of March. Then on the 8th of March, we had about 4 national institutions: the Federal Medical Center at Jabi, the National Assembly, the National Hospital, the Abuja Teaching Hospital, the National Assembly, the NIA, and the State House Clinic. So these ones were activated as a pre-rollout stations, and then now we're having rollout across the FCT, 65 vaccination points.
From the standpoint of the FCTA, why do you think those countries were pulling out of taking the Oxford AstraZeneca vaccine? And is there something that we should be worried about?
The important thing is this: when you have a vaccine that has been certified by WHO, that vaccine is safe. The processes of producing a vaccine and making it for public consumption is not a one-day job. It's not a one-person job. It's a consortium of experts.
So if it was safe, from the World Health Organization,
yes,
why were those countries pulling out?
I'm still coming up now. Do you know how many people that we have vaccinated before we got into this? And how many people have gotten with the adverse events that they are linking with the vaccine? And are you aware too that these adverse events, as at today, have not been substantiated? They have not been linked, because they have also looked at the general population before. What were the incidents of clotting before the pandemic even came? The correlationship is just there. There have been no change.
So for the Nigerian government and for the FCT, there's nothing wrong with this vaccine.
No, absolutely nothing.
No reports so far.
And we have shown that. You have seen the president, you have seen the vice president, you have seen the minister of FCT, minister of state of FCT. They have all taken these vaccines. You have seen me. We are fine. Well, before now, that is the preliminaries we had here. I told you that I will be feeling better after taking the shot on the 15th. Yesterday, I slept very well like a baby. So look at me today again. I'm still shining. You got some powders on me. But I'm telling you, let us face it, that this vaccine, up to this moment, is safe in this country. And we are maintaining our cold chain. The quality, the potency cannot be diluted down to the service points. So what are we talking about that we are working on a familiar terrain and tough, and I believe that the more we vaccinate, the more we are going to get the lessons. Yeah.
Many Nigerians do not believe in this vaccine. Many people think that this is all a hoax. And then there's a lot of vaccine hesitancy in Nigeria, even some state, even from people in government. Even some government officials have come out to say there is no COVID in my state and we will not be taking any vaccines. You know, in the FCT, what's your office doing about handling vaccine hesitancy here?
Thank you so much. Vaccine hesitancy can never be wiped out. Even when you have eradicated a sickness through vaccination, you can't say you have zero hesitancy. It is part of the process. But the important thing is the critical mass that is vaccinated. Have you achieved the critical mass that will cause the herd immunity? If you have achieved that, then even those that are hesitating will be protected. So what is the critical mass? We are looking at 70% of people to be vaccinated in this country, and the 40% in this year, and that will be about 85 million people Nigerians to be vaccinated. Then next year, 30%, about 65 million. So total, about 150 million residents of this country should be vaccinated against the COVID-19.
Just so I understand what you're trying to say is
okay.
that for us to achieve herd immunity in Nigeria,
a minimum of 70%,
we need 70% of people to be vaccinated.
Yes,
and this year the plan is for 40%.
40%, that's right.
And then next year 30%.
Okay. That's right.
Okay.
So having said that, you can see the first introduction. We are having 4 phases now. The first phase involves the frontline health workers. So I've seen it all. That we have seen the client that has come down with this sickness, the laboratory technician or scientist that has confirmed the infection. So what we are looking at now is trust, building trust. I'm not coming here to dispute the negative media hype, social media hypes, but we are here to give positive information to let people, to build that trust between the providers and the demand side. When we vaccinate you, we track you. And the tracking is not just for a day. There are numbers on that card. The disease surveillance on the physician officer. His number is put up there. So you have to report your symptoms as you are feeling them. And we have NAFDAC numbers. They have a software that you can easily fill in a very short time when you have any symptoms, and you should surely be linked to service. So we are doing that in spite of the fact that we don't have any severe or serious adverse events yet.
But just to be clear, it's possible that there will be side effects.
We have to be prepared.
Okay.
So that chain of command is there from the community to the referral centers at the tertiary level. So people should have that trust in government that COVID is real. And if you don't have that belief, that's the beginning of hesitancy. And when you see people that are taking this vaccine, you see the vials being opened, being prepared right there in front of you, and everybody is seeing that somebody like the minister has taken, president has taken, minister of state, vice president, and all the strategic leaders, they have taken this thing. They are not hiding it, and they are still working about it, they are still doing their job. So why are we not looking at it as a different thing?
All right, so let's take a look at the distribution plan for the FCT.
Yes.
65 centers and vaccination teams.
Exactly.
So how is this distribution going to happen? Is it going to be by area council?
Out of the 65 vaccination points that we are having, 25 is for AMAC, there's Abuja Military Area Council. We have 10 for Buhari Area Council. We have 10 for Gogolada Area Council. We have 8 for Kuje Area Council. We have 7 for Kuje Area Council. We have 5 for Abaji. And all these area councils have rolled out too after the FCT flag off on the 15th. And who are we vaccinating here? The strategic leaders, religious and traditional. So our rollout plan is in line with the national plan.
Okay.
And we observe the protocols.
All right, so the FCT minister is insisting that the cold chain facility for the FCT is active. Well, you know,
absolutely.
The question has always been about rural areas.
Yes.
So you've mapped out these places. What are you going to do to ensure that the vaccines actually retain their efficacy when they're taken in the rural areas?
What we are using now is the solar direct drive refrigerators.
What does that mean? Solar direct drive refrigerators.
You don't need light from the national grid. It operates with solar power.
Okay.
So that could be maintained, very easy to maintain, and is guaranteed that you have the temperature of the cold chain maintained at the appropriate.
So in the rural areas, how do we do this distribution?
We receive 115 of this, and we have 62 wards. It should be at least 1 per ward. So you can say that we are already overshot. We have the capacity to maintain the cold chain. So we have already established in all the service points, the service points that we are telling you now. If you go to any of them, you will see that that's solar direct drive refrigerator.
Thank you so much for being with us on Dateline.
Thank you, Kela.
The plan is to reach herd immunity by the end of 2022, and that will require about 70% of FCT residents to be vaccinated. Are you with this plan, or do you still have unanswered questions? Well, that's why we're here. Let us know using the social media handles showing right now on your screen. I heard a story many years ago. When trains were invented, people at the time did not want women to ride on trains. They believed that women were so fragile that anything moving more than 30 miles an hour would cause our internal organs to burst out of our bodies. That sounds silly today, doesn't it? We are celebrating being polio-free as a nation. But there was a time it was believed that the polio vaccine was created to reduce the world's population. Change is hard, yes. but we must evolve faster for the sake of humanity. That's Dateline Abuja this week. Thank you so much for watching. I'm Kayla Megwa. See you next time.